Now to a major milestone this week in the fight against breast cancer.
Joining us live this afternoon is Dr. Scott Maul with Aurora Health Care. This could change treatment plans for millions of women. Talk about that.
Absolutely. The trend in breast cancer care is to give better treatments that have better outcomes with less side effects. This is the Taylor X trial, which randomized over 10,000 women to treatment for breast cancer and found that 70% of them do not require chemotherapy as part of their treatment.
And how significant is that as far as the treatment when we're talking about if you can forego chemo, you're talking about how many months of not having to deal with that type of treatment?
And just the toll that chemo does on the body.
Absolutely. So chemotherapy can be up to 6 months in breast cancer treatment. It causes hair loss, it can increase the risk of infections, and there can be permanent complications like numbness or tingling in the fingers that can affect function and even threaten job loss.
What's the most important thing a woman needs to know in regards to this new information that we've just heard about and detecting breast cancer early?
I think there are several things. The first is that screening remains important to find breast cancer early when it's most treatable and when these techniques that we use to determine who needs chemotherapy or not are most successful. The second thing is this doesn't mean women don't need treatment. There is still treatment that's necessary for breast cancer, but we can also often use the least toxic options. And then third, clinical trials are important, and our patients who enrolled on this at Aurora really helped define a new standard of care.
Awesome.
Thank you so much for joining us, Dr. Maul. We will be right back.